What I want to discuss with you in this talk is to approach an effective manner to diagnose a true possession state, differentiating it from other medical and psychological conditions. In order to do this, we will take a look at some of the organic and psychological syndromes which are often mistaken for possession. And then we will look at what defines a true possession. When performing a psychological diagnosis, we attend to three causal arenas of disease observed in the signs and symptoms of a patient's pathological experience and behaviors. The first of these are the organic issues that may result in such experiences and deeds. The second are the interior psychological causes, and the third are due to maladaptive adjustments to the environment, which often means dealing with relationships and reactions to other people. This is a hierarchical form of diagnosis, going from the most simple level to the more complex, going from the organic or physiological anatomical possibilities all the way to the depths of the spiritual. Therefore, in order to perform a diagnosis of a true possession, we begin by looking to exclude organic causes. The organic must be excluded prior to moving on to next the psychological or environmental. It is only after determining that we are neither observing an organic, a psychopathological, or an environmentally induced condition that then we will finally turn to the arena of potential influence, the incorporeal spirits or entities. It's at another time that we will discuss the difficulties of specific cases, but for now and for simplicity's sake, let us assume that we have an individual referred because he is manifesting some very bizarre behaviors. Practically, by the time you are encountering this person, we must assume that these behaviors and personal experiences are of a truly bizarre nature, as most of our referral sources are sophisticated enough not to assume demons at a drop of a hat. What do we do then to determine what is going on? What do we do when that person is presented before us? How is it that we can make the differential diagnosis between something that may be demonic and something that is clearly not? Well, first, we have to take a look at that physical or organic condition of the individual. We ask such questions such as, have they been using drugs? Or have they ever used drugs? If yes, we need to find out what the nature of that drug is and when it was used. We also ask such things as, have they had a neurological exam? Have they had blood tests done? This will be in order to take a look at the potential of certain neurological disorders that mimic possession. And also, what is the genetic history of this person? Do we find other people in their family tree that have also had these types of behaviors and in like manner been diagnosed with some organic condition? Are they predisposed to tumors or to Tourette's or to seizures? With this in mind, we begin our diagnosis of the person exhibiting these behaviors by asking about drug use. After the last 50 years or so of common illicit drug use, we are all pretty aware of the effects of hallucinogens such as LSD, peyote, magic mushrooms on a person. We also are aware of the debilitating effects of methamphetamines, ecstasy, and even marijuana. We know that a person intoxicated with PCP can exhibit strength beyond normal, enough so as to cast large police officers aside like rag dolls. Our first question then of the person exhibiting these bizarre behaviors is whether they are presently influenced by some drug. To determine this, we can actually start to take a look at the indicators of intoxication, some of which are exhibited in symptoms such as assertiveness and belligerence, which often accompanies the abuse of inhalants and PCP. The bodily movements of an individual are often affected, and so we'll look at their own gait and movements. It's the reason that police officers have you walk the line on a DUI check. Their energy level may be affected, either being overly increased or decreased. Their speech and eye movements may be impaired, at times with the loss of ability to control the eyes. Already you can see as we're going down the levels of intoxication that a lot of these things are often interpreted as due to a demon. The anger and belligerence that is abnormal for an otherwise calm person, which in this case we're saying is very likely due to inhalant or a PCP, but somebody else might say has a demon of anger. The bodily movements where they're out of control of the person, now because of a drug, not because of something else. And likewise, eye movements are often an indicator of possession for, in many cases, during an exorcism, you'll have the person look in your eyes. And as they're looking, if they can't keep their eye on you, maybe something going on, and you're wanting them not to let the eyes roll back into their head, which can often happen during prayer sessions. But in this case, the eye movement problems are due to intoxication. Other ones are they may experience excessive perspiration and a dry mouth. They have internal experiences, including tachycardia, nausea, chest pain. Their judgment is so often impaired, with cognitive and sensory perceptions being skewed. And the intoxicated person's sense of self is often likewise impaired. They're not sure who they are, and their sense of time is distorted, with a sensation that time is passing very slowly, or they may have serious misperceptions of time in other ways. As you observe all this, and are attempting to determine is this intoxication or something else, probably the best manner by which to really be able to deal with this is to just merely ask the person, have you been using a drug? Have you used drugs? If the answer is no, and if you ask others around them, is this true? Are they using? And the answers come back no. Then the next step is to look at the possible neurological disorders. Two commonly known disorders that create bizarre behaviors and physical manifestations are Tourette's syndrome and temporal lobe epilepsy. Tourette's is characterized by common, simple tics, including eye movements and eye blinking, facial grimacing, shoulder shrugging, and head or shoulder jerking. You may hear them make simple vocalizations such as repetitive throat clearing, sniffing or grunting sounds, or more complex vocal tics, including those which are so commonly known in Tourette's where the person will let out a string of profanity. They may exhibit also self-harm, such as punching themselves in the face. So many of these are, again, signs that you may see in a possession, and people will jump to the conclusion it's a possession. But neurological testing and other medical exams can actually let us know that there is something else going on here that is of a physiological disorder, not spiritual. Another seizure disorder is temporal lobe epilepsy, which is a chronic neurological condition characterized by recurrent, unprovoked epileptic seizures, which originate in the temporal lobe of the brain. The seizures involve sensory changes, For example, there may be an olfactory illusion of smelling an unusual color. They may actually have smells of things that are not there in a hallucinatory way. And likewise, during temporal lobe epilepsy, there is commonly memory disturbance. Tumors in other portions of the brain, as well as traumatic brain injuries, which were on the increase due to recent wars, will also result in certain bizarre behaviors, such as ecstatic epilepsy. Ecstatic epilepsy may often be mistaken for what can be called an incubus possession, because there is a sense of bliss combined with sexual feelings and satisfaction. It can even seem beyond sexual and be experienced as deeply spiritual. There was one 53-year-old teacher who described her ecstatic seizure by saying, "The feeling was almost out of this world. This led to a feeling of complete serenity, total peace, no worries. It felt beautiful. Everything was great. Maybe the closest sensation that I know would be an orgasm. But what I felt was not at all sexual. It was almost religious." This was due to an epileptic condition. A recent autoimmune condition that mimics possession is one that's called anti-NMDA receptor encephalitis, an inflammation within the brain. This brain disorder is 80% more prevalent in women and is caused by antibodies attacking the brain, causing swelling and inflammation. The result is a condition where 1 minute you may act normally, and the next minute develop extreme paranoia or an inability to control your limbs. Some describe their brains as being even on fire. Another demon possession mimicking disorder is what has been referred to as Othello syndrome, or Lewy body dementia. It was named after Shakespeare's character Othello, who killed his wife Desdemona, believing that she was having an affair. Patients develop the same stubborn delusions of suspicion and jealousy toward their spouses, and constantly accuse them of infidelity. Some patients even have hallucinations of their spouse having sex with someone else. Most patients have a neurological disease affecting the brain's right frontal lobe. Sometimes it is brought on by the use of dopamine therapy for Parkinson's disease. If that's the case, then reducing or stopping the medication may alleviate the symptoms of Othello's syndrome. Like Othello, though, patients can become dangerously violent. Men with Othello syndrome have tried to strangle their wives or start fights with neighborhood men suspected of being their wives' lovers. Once again, it's not merely that here's an obvious neurological condition, but rather this is usually in a person that is otherwise acting normally and then switches because of the brain tumor and the injury. Huntington's disease also results in possession-like behaviors. It's caused by a mutation in the Huntington gene and so can be somewhat detected that way. And Huntington's disease is a rare inherited disorder and therefore one that can also be hunted down, if you will, by family tree exploration. But what it does is it breaks down the nerve cells in the brain over time, affecting a patient's behavior and movements. Now, a final illustration for these neurological disorders, and obviously you're beginning probably to see now why it's important to be able to have some sense that how these things so clearly mimic what we think of as possession. A final one is an interesting one known as McLeod syndrome. It's interesting Because according to Southern Methodist University researchers, MacLeod syndrome may have been the real reason Henry VIII of England beheaded 2 of his 6 wives. Initially, Henry VIII was a strong, athletic, and gregarious man. But then around age 40, he began to experience weakness and atrophy in his legs that eventually caused immobility. He also descended into psychotic paranoia, ultimately beheading his wives. MacLeod syndrome is specific to what is called the Kell group of blood group types, which causes difficulty also in pregnancy, which may also explain the difficult pregnancies of Henry VIII's wives and his mistresses. They were pregnant with at least 11 of his children, but only 4 lived past infancy. If Henry VIII carried the Kell antigen in his blood and his women didn't, then they would only been able to have 1 healthy child before losing everyone thereafter. MacLeod syndrome is a neurological disease that typically starts in midlife and is typified by seizures, muscle weakness and atrophy, involuntary jerking of legs and arms, grimacing, and vocalizations like grunting and mental deterioration, depression, anxiety, emotional instability, and lack of self-restraint. So these are merely a handful of the neurological disorders that mimic some of the bizarre behaviors we encounter in a true possession, and presented here in order to illustrate the complexity that we encounter when presented with someone exhibiting bizarre behaviors and experiences. As we progress in our determination as to whether someone is possessed or merely expressing a neurological disorder, we observe the unique symptoms which comprise the syndromes described. This set of symptoms, as well as the blood tests and the brain scans, all serve to indicate whether or not this is obviously neurological or not. Next, assuming that we found nothing at these first levels of the organic, we begin to observe the possible environmental and cultural factors which may influence and explain the behaviors and symptoms observed. Possession-like behaviors may be influenced by circumstances in which a person finds themselves, circumstances that allow possession-like symptoms to be more functional than other explanations. For example, when a person is in a culture or a situation where possession mitigates a sense of guilt, or where it functions to keep the person as a part of the community rather than being ostracized, possession explanations may be the best one that people can take. For example, where a person would otherwise be punished as a perpetrator or of socially inappropriate behaviors, or is just seen as downright rebellious against the culture, and that this was their will to perpetrate the evil or to be rebellious, then they may be cast out of the community. But when it's seen as due to possession, then the person is no longer viewed as crazy or as a problem, but rather as a victim. In that case, the community may gather around them rather than ostracize them. It's a case of the cliche, the devil made me do it. An example of such a situation was a case presented to me of a man accused of rape, he claiming that he was possessed at the time. He said he had seen a woman carrying groceries down the street and then, for unknown reason to him, began to follow her. He then followed her into her house and while in the living room attacked her and began to strip off her clothes. However, prior to sexually assaulting her, he stopped, fell back against the couch, and told her he did not know what he was doing there. In a state of seeming dissociation, he remained there while she called the police and until they arrived. Later, he would say that he was possessed at the time. It was only I was given then an interview, a video of the interview and of an exorcism or deliverance by a Pentecostal minister, and was not really able to definitively determine whether or not he was possessed. However, whether he is possessed or not, the claim of possession personally absolved him of guilt and was used to say that he was as much of a victim as was his true victim. The devil had made him do it. In certain other cultural situations, we see possession behavior as the rationale for acting in a socially inappropriate manner without incurring the censure of that society. In other words, we need to be able to take a look at the cultures and subcultures of these people to answer, is this behavior, is the idea of being possessed a beneficial one to them? It was, in this previous case, much more beneficial to say you're possessed than you are just a willful rapist. In the sense of culturally, for example, in most Islamic cultures, women are not allowed the freedoms of expression and liberality of a man. Men can divorce women, women cannot divorce men. When a woman acts in an inappropriate manner, the determination that she did this willfully could end up with her being killed. However, if it's determined that she was possessed, then it becomes excusable, and that rebellious behavior is seen as being one that was induced by a demon rather than by her. And when she would normally have been possibly punished, killed, or kicked out, she's allowed to stay a part of the society. A well-known form of this is known as czar possession, which is found in many of the Islamic countries of the Middle East and Northeast Africa. During a czar possession, a woman can express herself emotionally and sexually, as well as exhibit her power over men of the society, without fear of retribution. When such a possession occurs, a woman shaman is then called in, and the friends of the patient gather for an elaborate ceremony. During this ceremony, there is frantic dancing and release of affect, culminating with the belief that the czar spirits that have taken over this woman arrive and then have intercourse with the rest of the women. The ceremony of exorcism has then been completed as the spirits leave, and the patient is then reintegrated into the normal aspects of society. Not only are there cultural factors that are a determinant, but it's also intrapsychic dynamics of absorption of the psyche and of psychic contents of another person. We say that again, there's not only just outward cultural factors that may influence another person's behaviors, thoughts, soul, but there are even the intrapsychic dynamics of one person that can be absorbed by another person and create bizarre behaviors. Two examples may illustrate these causes. One is that of what is called a shared paranoid disorder. Here one person appears possessed by another's thoughts and feelings, as if a demon is afflicting both of them. Rather, though, it is a mental illness in which a healthy person starts to take on the delusions of someone who has a psychotic disorder. Another common but often overlooked example is in cases of children, where a child's developing but still weak ego is influenced by the parents' unconscious, and the child is seen to have dreams that are much more related to the parent situation than to themselves. These create nightmares that are almost unresolvable. They overwhelm the child and induce behaviors that for the child feel like they're not originating within him or her, because actually they're not. They're originating in the adult, the parent. And because they are not, that child feels possessed. In shared paranoid disorders and in such unconscious psychic insertions, we can determine whether this is there by, once again, looking at family history and interviewing the other people. A case in mind, a young boy was extremely angry, and it seemed for no reason that the school was not going to let him come back in. They thought he was hyperactive because he could not sit still. When exploring the family dynamics, two really well-mannered Christian parents were interviewed. As I'm asking them about themselves, I asked them just bluntly, how's your marriage? The wife says, horrible. I don't even like him. To his shock, because they hadn't talked about this. Her anger had been so present in the unconscious and not expressed in the outer world that this boy had picked it up. His father's agitation as well had been picked up because somewhere inside he knew this. When the parents acknowledged their own feelings and thoughts, seemingly miraculously within a day the boy was relieved of his anxiety, his anger, and his hyperactivity. However, again, for the sake of simplicity in our discussion today, let's assume that these type of determinants are not present. That there is not an organic issue, there is not an intrapsychic issue from someone else or cultural and the like. This then brings us to the intrapsychic origins of the signs and symptoms exhibited. Possession phenomena often look like various mental illnesses and other forms of psychopathology. Obviously, if a person is either seen by others or experiences themselves to have a sense of being out of control of thoughts or having their actions seemingly out of control, our thoughts would immediately turn to obsessive compulsive disorders, obsessions, and addictions. When the person experiences a sense that there is another in control of them, we begin to wonder about multiple personalities or other dissociative states. As they begin to explain that they're hearing voices and sounds or seeing apparitions and speak of demons possibly around them, our thoughts turn to the various possible psychoses. The possessed person then relate that they feel both empty much of the time, but elated during times of being controlled. And then we view the various manifestations of the manic depressive disorders. So whether it is a psychotic, anxiety, mood, or personality disorder, each seems to have its rightful place in the diagnosis of the possessed individual. However, when examining a potential psychopathology, we do not observe only one or two symptoms or signs, but understand disorders to be syndromes, sets of signs and symptoms that commonly group together. For example, when diagnosing a depressive disorder, we look for a consistent set of signs and symptoms that are indicative of the depressive syndrome, not merely the symptom of sadness or of emptiness, in order to diagnose a mood disorder. When looking at a true possession, we find that the individual does not fit, though, into any of the full syndromes we've known in present psychopathology. The person may have features of many disorders, but none of the disorders rise to the level of criteria of a full psychopathological syndrome, which is necessary for a definitive diagnosis. In my work, In Bondage to Evil, you can actually find a greater in-depth discussion of how to distinguish amongst these various specific diagnostic categories and possession phenomena. But once again, for our purposes today, let us suppose that we have gone through that diagnostic manual, we have gone through the interviews, and find that the individual does not adequately fall into any clear syndrome of mental or personality disorder. It is now then that we begin to entertain the possibility that the cause of the problems is once again environmental. Only this time it's not the material world of the environment that causes the problem, but the invisible world that is now populated by angels and demons that is affecting this individual. When asking ourselves of whether this possession is of demonic origin, once again we do not look at a singular behavior, but rather look for the syndrome, a set of signs and symptoms once again taken together to determine the diagnosis. There is such a syndrome, which we're calling the possessive states disorder actually, and really does describe what is typical for a possession situation. Let us begin to take a look at this syndrome. First, the person experiences being controlled by someone or something alien. Second, their sense of self fluctuates between feelings of despair, depletion, or an experience of inner emptiness, and then the feeling of inflation and grandiosity. These two in combination are a good start to differentiate the possession from physical and psychological maladies, but they need a third element to bring true confidence. There now is some form of traditional possession phenomena, such as poltergeist activity, trances, apparitions, and the like. We will return to look at these in more depth momentarily. When looking at this, we saw criteria that were set up in order to bring about a sense that this is going to be a true possession. Though many of the individual behaviors we found in all the others, organic to psychological to environmental, still we're going to find the syndrome is present. The first criteria necessary for a possession is seemingly obvious. It is an experience of being controlled by someone or something alien to oneself. This with a subsequent loss of control in one of four areas: thinking, anger and profanity, impulsive behaviors, or physical reactions. You only need one of those four, but there's a loss of control, but the perception is that you're not in control. This is not you. The loss of control of thought can be in the form of ruminations, obsessions, temptations, expectations of disaster, harm, or death, and the like. In the extreme, these may seem to take the form of even delusions, yet the thinking is truly not delusional, since the person does not accept these as his or her own beliefs, but experiences these thoughts as those of the controlling entity. The uncontrollable anger can be seen in sudden outbursts of fury, excessive anger, or the tendency to counterattack any perceived threat. The person may also begin to have uncontrollable outbursts of profanity. We saw this in Tourette's syndrome, but in the possession, it may be also expressly related to religion or to those who are religious. Impulsivity may be seen in almost any of the areas of life, such as gambling, substance abuse, overeating, sex. The uncontrollable physical reactions can be seen in such things as uncontrolled contortions of the body, facial distortions, and loss of certain physical functions for no apparent reason. The second necessary criteria is that the person's sense of self will fluctuate between feelings of despair, depletion, and an experience of inner emptiness. These will fluctuate with feelings of inflation and grandiosity. These fluctuations may vary in duration, with some persons exhibiting one or the other predominantly. The fluctuations differ from those seen in narcissistic persons, where the fluctuations in mood are dependent on external circumstances. The person in a possessive state fluctuates in mood due to internal cues, not directly observed by witnesses. The feelings of emptiness and depletion usually occur during periods when the person feels in relative control of him or herself, while the inflated periods are usually associated with times when the person experiences him or herself not in control. So what you can see is when the person actually is possessed, they're getting a great deal of energy from the possessing spirit. But when that spirit leaves and leaves them alone, they feel like themselves again and feel depleted. In voodoo, it sometimes was called riding the horse, which would be that the demon would come and ride the person like a horse and then leave them sweaty and exhausted afterwards. The emptiness and depression can be seen in periods of sad affect, inappropriate feelings of guilt and worthlessness, a perceived loss of energy, loss of interest in usual activities, suicidal ideations, threats, and even suicide attempts. The person may also express these feelings of emptiness as a feeling of inner darkness, a feeling of being depleted or drained by one controlling them, or even say that it feels like there's a void within. While the periods of inflation are marked by egocentric, self-indulgent behavior and attitudes. The person may seem vain and demanding, have grandiose sense of self-importance, and may be preoccupied with fantasies of power, brilliance, beauty, or ideal love. This person may then expect special favors from others without assuming any reciprocal responsibilities, and show little caring or empathy for others. Also characteristic of this disorder are certain visions and voices seen and heard by the afflicted one. There are also dissociative aspects, or revulsive religious reactions to behaviors and religious objects. We also hear of paranormal and parapsychological occurrences, as well as certain phenomena experienced even by the others in the vicinity of the afflicted one. Often a person in this state of being possessed will experience seeing dark figures and apparitions. They may also hear audible and coherent voices. Now these voices have a greater sense of integrity than usual or typical hallucinatory experiences of the schizophrenic, and are not the result also of a known organic condition. The individual experiences these voices and these visions as completely alien and separate from him or herself. They are not experienced as dreamlike, nor does the person feel as if she or he has lost touch with reality. Rather, the vision or the voice has such an integrity that the person can maintain an adequate processing of external reality while the vision and voice retain their quality as well over time. And these visions and voices are recognized as being distinct in themselves. Now you'll find that in a study of psychosis it's not true. There's a confusion often that can go on, a disturbance within the psychotic's mind about, is this real? But yes, of course it's real, and the inner argument of that versus a sense of, in the possessed, often it's a disbelief, but they know it feels very different. The presence of trances and more than one personality are also frequently encountered. And when more than one personality is encountered, the person may be in a trance state, and so is unaware of its presence. However, in rare instances, the person may experience these other personalities during normal consciousness, and may then be in communication with these other personalities. When more than one personality is present, the distinction between the possession state and the dissociative identity disorder or multiple personality disorder is then made much more difficult. Each have the same symptoms of more than one personality present in the same individual. However, in the multiple personality or the dissociative dissociative identity disorder, the presence of the personality is the dominant and predominant symptom, while it is actually secondary in the possession state. Again, in a multiple personality disorder, that presence of that other personality is the major symptom, while in possession, this rarely shows up. Usually, as another personality will only clearly show up in the midst of the exorcism, for the demon is attempting to hide. Other personalities in a multiple personality disorder often are not attempting to hide, but actually take control. Also in the dissociative identity disorder, the behavior of the alternate personalities can take any general form, while in possession, the sense of being controlled by others and the affective fluctuations and other behaviors are more specific to what that demon is wanting you to do. Aside from the prominent features described here, there are other features associated with the possession state. Associated with the anxiety and depressed affect during the emptiness phase are various physical manifestations such as a great deal of sweating, increased heart pounding and respiration, clammy hands, dry mouth, upset stomach, diarrhea, facial flushing, and the like. Some persons may also experience extreme tension and shakiness and an inability to relax. Already you're hearing, this sounds like the neurological disorders again. But as we once again get into this, we see that these are the common reactions also for anxiety and the like in the body. That the body is going to react, whatever the cause. The body is going to respond to anxiety, whether it is coming from a neurological disorder or a demon, in the same way. And that's once again the reason for the syndrome that we need to look at. Some of the other indicators that round out the recognition of the true possession are: the person experiences visions, voices, or feelings as truly coming from outside. Events are perceived as due to possession are spontaneous, immediate experiences, rather than subsequent interpretation of events. And when an event occurs, it is experienced as real on its own rather than as an as-if situation. So often we'll go, it's as if I saw something. And the possession is, I did. It's as if I'm hearing something. No, I'm hearing it. That's the difference. Possession does not go by an as-if situation. True possession carries an otherworldly sense, usually accompanied by fear. And unlike psychotic events, there is an unusual clarity to the experience, a clarity marked by the gaining of a cognizance that is instantaneous rather than gradual. It's like the awareness gained when actually listening to another person speak, rather than knowledge gains by means of reasoning through a personal thought. Clarity is also exhibited in the establishment of the experience in long-lasting memory. And finally, when a visual image is involved, there is usually some form of luminosity involved. They see either a light around the vision or shadowy darkness. The diagnosis can then be made by the following process. 3 criteria are needed to be present. First, there is the experience of being controlled. A form of obsession or compulsion is present. Second, there must be some sense of self which fluctuates between periods of emptiness and periods of inflation. A form of manic depressive disorder seems there. And finally, at least one of the following from a third category must be present. The person must experience visions of dark figures or apparitions, or hear coherent voices which have a real and not dreamlike quality. If not that, then trances or the presence of more than one personality should be present. There also may be variations in the voice or ability to speak or understand a previously unknown language. There are, if not those two, potentially revulsive religious reactions, such as extreme negative reactions to prayer or to religious objects. The ability to articulate the name of Jesus or the destruction of religious objects might happen. Or, conversely, there may be some form of paranormal phenomena, such as poltergeist-type behaviors, telepathy, levitation, or strength out of proportion to age or situation. Finally, there can be also just an impact on others. For others that are there may have paranormal phenomena happening around them. They may smell a stench. There may be a coldness or a feeling of an alien presence, or that the patient has actually lost a human quality. Any of these might be experienced by others around the patient. In common practice, you will hardly ever see all of these behaviors and experiences in one situation, but may end up going into your discernment as well, with this as a combined best guess. This is why there only has to be, out of those final ones, only one. It's the out of control, and that sense that you are being controlled by another was one. The manic depressive 2, and then one of these others, because you probably will never see a person levitating, having visions, speaking another language, stenches. That's in the movies. So as you can see, much of the work of diagnosis is the complex interaction of determining the organic, environmental, cultural, and psychic aspects of the phenomena encountered. However, in the end, the final confirmation comes in the act of exorcism and prayer. When the act of exorcism is undertaken, we ask, does it have any effect? It's also one of the good diagnostic factors in the beginning, to when meeting with a person, pray the prayers with them and see what happens. The patient, once the exorcism begins, will either begin to find relief or the symptoms may become more intense. If the origin, however, is primarily within the psyche, then these prayers over time will have little effect, and we will begin to know we are dealing with a disorder that is more amenable to psychotherapy than to exorcism.